Good afternoon, everyone. Welcome back. I'm Steve,
And I'm Scott.
and together we're backyard musings, broadcasting live Apple Valley, California.
Yep, and we're talking science and technology again.
Yes, sir. A new study warns that time spent by children and young adults on phones, gaming consoles, and other electronic devices may endanger their heart health. I wonder if is that just limited to children? I mean,
I don't think so.
Adults.
Yeah, I don't think so.
Spending long periods of time on phones, computers, gaming systems, or other electronic devices may raise the likelihood of developing cardiometabolic problems, including high blood pressure. We talked about high blood pressure this morning. Elevated cholesterol and insulin resistance, according to new research published in the Journal of the American Heart Association on August 8th, 2025, and open access peer-reviewed publications. Would you like to know more?
You threw me off there. In 2023, the American Heart Association reported that cardiometabolic risk is accruing at younger and younger ages. That's a quote, and found that only 29% of U.S. children and teens between the ages of 2 and 19 showed healthy cardiometabolic profiles based on data from 2013 to 2018. Collected through the National Health and Nutrition Examination Survey. Didn't even know there was one of those.
Huh. I wonder if that's a correlation to hypertension. Remember, 30% missed? Huh. Yeah. Because this is 29% of U.S. children. The latest analysis, which examined data from more than 1,000 participants in 2 Danish studies, Denmark, revealed a clear link between greater recreational screen use and increased cardiovascular and metabolic risks among young people.
Using data from a group of 10-year-olds studied in 2010 and a group of 18-year-olds in 2000 that were part of the Copenhagen Prospective Studies on Asthma in Childhood Cohorts. Researchers examined the relationship between screen time and cardiometabolic risk factors. Screen time included time spent watching TV, movies, gaming, or using phones, tablets, or computers for leisure.
Researchers developed a composite score based on a cluster of metabolic syndrome components: waist size, blood pressure, high-density lipoprotein, or HDL, the good cholesterol, triglycerides, and blood sugar levels, and adjusted for sex and age. The cardiometabolic score reflected a participant's overall risk relative to the study group average, measured in standard deviations. 0 means average risk, and 1 means 1 standard deviation above the average.
The analysis found that each extra hour of screen time increased the cardiometabolic score by about 0.08 standard deviations in the 10-year-olds and 0.13 standard deviations in the 18-year-olds.
Sounds minuscule.
Yeah. Quote, this means a child with extra 3 hours of screen time a day would have roughly a quarter to a half standard deviation risk rather than their peers. That doesn't sound like it's that much, really. Is it really? I mean, I'm not promoting. I'm not promoting
large.
Yeah, I think kids should get out. Yeah, I guess.
Quote, it's a small change per hour, but when screen time accumulates to 3, 5, or even 6 hours a day, as we saw in many adolescents, that adds up, he said. Multiply that across a whole population of children, you're looking at a meaningful shift in early cardiometabolic risk that could carry into adulthood.
Okay, I got a question. So, screen time. I see that note come up on my iPad a lot, where it says your screen time average
6 hours
down,
and whatever.
Yeah,
10 minutes.
But does that mean I'm actually looking at it? I mean, does that mean that the screen is actually on, or is it just the machine is on? Because I don't ever turn off my iPad. So it's on all the time.
What do you think when it lights up? Then that means you're looking at it?
Yeah, I don't know.
What if you set it down and it's still lit up? What if it's on the phone and the camera? When you put it on the camera, it never goes off.
Right. Yeah, so I don't understand. Because I mean, look, it tells me, and maybe, I'm not trying to be a denier, but sometimes it says like your screen time's like 4 hours a day or 6 hours a day or whatever. There's no way that I'm on it that much, but maybe I am. I'm just, like I said, I'm just denying. The analysis also found that both sleep duration and sleep timing affected the relationship between screen time and cardiometabolic risk. Both shorter sleep duration and going to sleep later intensify the relationship between screen time and cardiometabolic risk. Children and adolescents who had less sleep showed significantly higher risk associated with the same amount of screen time.
Okay. Quote, in children, sleep duration not only moderated this relationship, but also partially explained it. About 12% of the association between screen time and cardiometabolic risk was mediated through shorter sleep duration, Horner said. These findings suggest that insufficient sleep may not only magnify the impact of screen time, but could be a key pathway linking screen habits to early metabolic changes.
In addition, a machine learning analysis
AI. That's AI.
Identified a unique metabolic signature in the blood that appeared to be associated with screen time. Quote, we were able to detect a set of blood metabolite changes, a screen time fingerprint, validating the potential biological impact of the screen time behaviors, he said. Going on with a quote, using the same metabolomics data, right?
That's a tough one, man.
Metabolomics.
I don't know.
Okay, whatever that data is. We also assessed whether screen time was linked to predicted cardiovascular risk in adulthood, finding a positive trend in childhood and a significant association at adolescence. This suggests that screen-related metabolic changes may carry early signals of long-term health, heart health risk. Whatever.
Amanda Marma Parek, a medical doctor, MSCI and FAHA, chair of the American Heart Association Young Hearts Cardiovascular Disease Prevention Committee, who was not involved in this research, said focusing on sleep is a great starting point to change screen time patterns. You try getting Cameron in bed at time. His bedtime's 8 o'clock. He's in his bed around 8:30 and just cuddling and talking and laughing and giggling until about 9.
Yeah, and do you notice anything weird?
Up at 6.
Yeah, exactly. So how much sleep anyway?
It's 8 hours.
Yeah. Adults can also set an example, she said. Quote, all of us use screens, so it's important to guide kids, teens, and young adults to healthy screen use in a way that grows with them. As a parent, you can model healthy screen use, when to put it away, how to use it, how to avoid multitasking. Yeah. And as kids get a little older, be more explicit, narrating why you put away your devices during dinner or other times together. Okay. So yeah, you got to have some family quality time. So,
quote, make sure they know how to entertain and soothe themselves without a screen and can handle being bored. Cameron says that. I'm bored, Dad.
Yeah.
Well, you're grounded from TV, Cameron.
That'll help.
Boredom breeds brilliance and creativity, so don't be bothered when your kids complain they're bored. Loneliness and discomfort will happen throughout life, so those are opportunities to support and mentor your kids in healthy ways to respond that don't involve scrolling. This is coming from a nerd.
You said it. As an observational study using prospectively collected data, the findings reflect associations rather than proving cause and effect. Moreover, parents of the 10-year-olds and the 18-year-olds reported screen time through questionnaires, which may not accurately reflect the actual time you spent on screens. So they're,
there's some flaws in there.
Yeah. Is your screen time between 2 and 5 hours, between 6 and 10 hours, whatever. Yeah. What do you do?
Horner suggested that future research could explore whether limiting screen use in the hours before sleep, when light from screen exposure may disrupt circadian rhythms and disrupt sleep onset, may be an avenue to help reduce cardiometabolic risk.
Okay, here we go. Study details, background, and design. The two prospective research groups at the COPSAC in Denmark consisted of mother-child pairs with analysis of data collected at planned clinical visits and study assessments from the birth of the child through age 10 in the 2010 study group and 18 in the 2000 study group.
Okay. Through questionnaires, parents of children in the 10-year-old group and 18-year-olds detailed the number of hours the young participants spent watching TV or movies. Do you think they really shaved it down? Because the adults are wanting to find out. Gaming on a console TV and using phones, tablets, or computers for leisure.
For the 2010 group, the number of hours of screen time was available for 657 children at age 6 and 630 children at age 10. Average screen time was 2 hours per day at age 6 and 3.2 hours per day at age 10, representing a significant increase over time.
For the 2000 group, year 2000 of 18-year-olds, screen time was available for 364 individuals. Screen time in 18 years was significantly higher, an average of 6.1 hours per day.
Okay, well, but at 18, you're probably, and again, I'm not making excuses or defending them, but you're probably,
TikTok,
yeah, you're doing
Instagram.
Research, right? You're doing research on
that's part of it.
School, you know.
That's part of it.
Yeah. Sleep was measured by sensors over a 14-day period. So,
I don't know. It's a fight with Cameron to get him down and to keep him down. I mean, he wants to come into our bed. I mean, we just bought this new bunk bed where there's only about 18-inch gap between the bed and the ceiling, so it's hard to get in, or 2 foot. It's hard to get in there, especially at night when you go pee and you're disoriented and you got these stairs to climb up. He just comes into our bed and it's annoying. We need to get a new bed for him.
You just got that bed, didn't you?
I know, we just got the bed.
Can you shorten it? Can you lower it? I mean,
I suppose if I cut the legs down, but then it might go catawampus.
You have to talk to an engineer about that.
Yeah. Well, one unnamed person is not going to admit that it was a bad idea.
Oh. Okay, we will not go there.
That would never happen. And Loki, if you tell her I said that, I will deny it.
We will not go there. Okay.
Actually, it's on tape, so I can't deny it. All right, folks. Thanks a lot. Have a good one.
See you tomorrow. Take care.